Hey everybody, welcome back to the Teach Back Method, where I teach you guys something I'm learning about in grad school to help me understand it better. For today's video, we're going to discuss another cervical condition, cervical spondylosis. Let's break it down. So, what is cervical spondylosis? It's actually a big umbrella term, and there's a couple different ways we can describe it. The big one that people typically know and can relate to is arthritis. So, we're having a lot of wearing down going on throughout our spine. So, what we're going to see is decreased vertebral body, or it could also be a decreased disc. So everything's rubbing on each other, and this can actually cause compression of different neural structures. So when our patient comes into the clinic, they're going to describe their condition a couple different ways. The first thing they're going to say is, hey, I have morning stiffness. When I wake up, my neck feels really stiff. We can also see a gradual onset of radicular pain. And lastly, they're also going to say that their pain is worse with upright posture and activity. When we're doing our exam on a patient, there's a couple different findings that can help us conclude whether or not it could be cervical spondylosis. The big thing is limited range of motion and accessory motion in a capsular pattern. So think about it. That is going to be more limitation when we're side bending or extending. Let's see. So here's two vertebrae. When we're flexing, we have that increase in space. When we're extending, we have that rubbing against. So if we're having a decreased disc or a decreased vertebral body, it's just shredding against each other. Same thing when we're side bending, we have that shearing going on. Of course, when we have all these findings, it's not always going to be cervical spondylosis. So a couple of different differential diagnoses to keep in the back of your head. Tumor, multiple sclerosis, or rheumatoid arthritis. With all this in mind, what can we do to help our patient? There's a couple different interventions, but I'm only going to discuss a few. First off, we want to control our pain. If our patient's pain is so bad that it's debilitating, they're not going to be able to do much else. So we want to control the pain. A big thing we want to focus on is stabilization. We want to stabilize our cervical spine. We can also do some muscle strengthening to help recruit our deep flexor muscles. And lastly, some manual therapy could be appropriate, such as mobilization or manipulation. I hope you guys learned something in this video. Come back to my page to learn more.